Victoria City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Good quote on something you need from Phyathai Sriracha. Somebody said to me recently they're about 30% cheaper than Bangkok Pattaya Hospital, and they've got the same equipment, so have a worth checking out. Now, Dr Kanaphat, welcome. If you can tear yourself away, come on up and enlighten us about shoulder problems. Oh, by the way, Daryl and our tech coordinator Brad is not here because they both ate at the same place yesterday and have food poisoning. Nothing to do with their shoulders, but this is all about shoulders. Thank you for coming. First ever speaker from Phyathai Sriracha. Big round of applause.
Thank you. It's my pleasure to come today, okay? Good morning, ladies and gentlemen. Oh, we got a very big group today, so I'm just like very nervous. So, but feel free if you need any question, you just hold your hand and okay, I can answer it like away, okay? So feel free to ask, okay? Today I'm gonna talk about the common shoulder problems. I think everyone in this room have some problem of shoulder, much or less, okay? Let's see. Oh, sorry, I forgot how to click. Okay, today I have no disclosure, no any sponsor, anything. So let's have a look. This is the sport, so, okay? 6 sports. Baseball, the football, I also include the England football, okay? The basketball, the tennis, swimming, and golf. Anyone has the experience of the 6 sports today? Can I see your hand? You have played it all 6. All 6 sports. All 6. Anyone got 5? 5 spots. You have to play it. And the time 4. Anyone got 4? 4. Oh, okay. 1, 2, 3. Okay. 3. 1, 2, 3, 4, 5, 6, 7, 8. Oh, that's about 20. Okay. 2. Anyone got 2? Okay. Much. Almost is 3. Okay. 1 spot. Okay. Anyone wanted to share your experience? You have a good at this one of 6. Anyone want to share? Okay, you can share it. Okay. But I tell you that every sport they have a shoulder problem. If you got a problem, you cannot play this kind of sport. Okay, including the football, the England, like David Seaman. When we got a shoulder repair, he missed a lot of match, a lot of time. So the problem is if you got a shoulder problem, you got the problem of your sport, of your activity. So I like to see you enjoy. Most of you got a 3 of 6, so it's very much than I expect. Okay. Let's see the anatomy of shoulder. From the past, since Da Vinci to the NASA, we still got the same shoulder. We got the old shoulder with the more the motion we can do is like a 180. Okay. May I have a look one more time? Do you got the 180 degree of your hand up? 180? Oh, you got it too. Oh, you got it. You got. Most of you got it. Okay. 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 Wow. Okay. So you got a healthy shoulder. I'm happy about that. Okay. This is the shoulder motion I'm gonna talk today. If the arm stayed like here, this is the forward flexion. We got 180. Okay. This is extension. We got a 60. This is AB abduction on the outside. The AD adduction in the inside. The external rotation. The internal rotation. Okay. If I got the too low volume, you can tell me. Okay. I can make it more high volume. Okay. Because sometimes I've got nervous and I got was like a low volume. You can ask me. Okay. why our shoulder have so much motion. I think it's got a big motion in our body because we have ball and socket joint. Okay, the humerus or the circle around here is the ball, and the scapula or the glenoid is the socket. So that's why we got a very very high motion on the shoulder. About the muscle, we got more than 20 muscles on the shoulder. So that's why it's very complex anatomy. Okay, but you got a big deltoid on the lateral side, on the sideways. You got a bicep on the front. Okay, you got a trapezius on the back. You got a tricep on the back of the arm. That's the big muscle you see from the outside. Let's see some statistics. Oh, what do you think of most of the patients come with a shoulder problem? Mostly it's about 50 to 60 years old. Okay, this is the high peak of it. Okay, in the 1,000 patients in the Sweden. Okay, the next is also the same. It's peak about 50 to 69 patients age that come to the shoulder problem. So it's similar to all over the world because it's up to the activity of each country. But I think this is not too much vary in the Thailand also. I think this is the important one, the duration that you come to see the doctor. Okay, most of the time you got more than 3 months of the shoulder pain, more than 50%. Okay, 20 to 25% you got more than 3 months of the shoulder pain. More than 6 months is about 10 to 20%. More than 12 months, more than a year, you got more than 50% of the patients have more than a year. The duration is so long. Anyone got that experience? You got a bad pain on the shoulder more than a year in this room? Oh, I'm happy. I'm happy not to see that. Okay, but yeah, the statistics also show that. So, at the first common shoulder problem, anyone to share any experience? Do you have a shoulder problem? Before we go next, okay, please. We have another microphone. Oh no. Okay. Okay. Okay.
Didn't quite catch whether you said a shoulder problem for a long time. I only had mine for a very short time. I've had it 2 or 3 times. A very big pain in the shoulder and down the left-hand arm. And it was here a couple of weeks ago where a doctor here told me I should be a good idea to go to the hospital because it's on the same side as the heart, and I have AF. So at any rate, I'm one of these people can enjoy going to the hospital because we can't do that in England. You know, we might wait a year to go to the hospital, and then 2 or 3 months to see a doctor. So I go along there, blood pressure, blah blah blah, paracetamol, and everything's all right. But I still don't know why. I've never known pain. I've never in my life known the pain that I had in my left-hand shoulder a couple of weeks ago.
Okay, thank you for the question. I want to explain the heart side. So they got the problem of the shoulder is not always the shoulder, because there sometimes it's outside the shoulder. Okay, the things that I'm commonly to do is the spine, the cervical spine. Sometimes the cervical spine has the liver pain to the shoulder, to the arm, to the hand. That's why we got to check up your spine too, your shoulder too, and your heart too, because your heart is also liver pain. And you got a heart attack. It's on the shoulder side, left shoulder also. That's why today common shoulder, but we have to careful the other thing that not shoulder also. Okay, the spine too, the heart too. Okay, okay, please you can share because I have a time today. Okay.
Hi, good morning. I suffered from a frozen shoulder for about 2 years. and even now it's recovered to a great extent. I haven't got the mobility and the movement that I used to have and that you showed earlier.
Okay, this will be the next topic of the common shoulder. So after this, I will, if you have problem, I will answer them. But the frozen shoulder, normally it not come with the only frozen. It may come with the rotator cuff or maybe impingement or maybe another source of the frozen. So I will tell you in the next few slides. Okay.
No,
Can
Doctor.
please.
Hello. I think this is going to be a very interesting conversation because I think there's a lot of pain everywhere.
Yeah.
But a lot of pain, I understand, also comes from your second and third cervical at the back,
Yeah.
especially wear and tear. I've got it, and I think many others have. But it's accentuated because, once again, I had a frozen shoulder, and in those days they injected with what they call gold injection. I suppose it was the forerunner of what you do now, essentially, and it's got rid of it. But I find the swimming, if I tried to do this, really hurt inside. So interesting conversation coming up, I think.
Okay, thank you. So I mean the next few slides will be tell you about more detail that you're gonna look for. Okay. Okay. Next, common shoulder. The first common is the rotator cuff tear. Rotator cuff we got 4 muscles, but it's deeper than the deltoid. Okay, it's on the it attached to the bone. What we got first, the supraspinatus is on the roof of your shoulder. The subscapularis is on the front. The infraspinatus is on the back. And teres minor is also on the back. So we got the 4 rotator cuff. What the symptom? When you got a tear of the rotator cuff, maybe trauma, maybe repetitive activity, it got with pain, we got weakness, we got limit range of motion or some stiffness. But in the early stage, we can test by the doctor. We have to test with physical exam. So we can tell you that which side of the rotator cuff that have a problem. Like the supraspinatus, we know it got in the loop. When the muscle contract in the loop, we got the abduction. So if you lost the abduction or you lost pain on the abduction, it may form the supraspinatus. Or if you got the subscapularis tear is on the front, subscapularis is for the internal rotation of the shoulder, and you got the pain and you got a limit range of motion, maybe it's from the subscapularis. So each muscle have a test, and the test have a many tests of the. So I think we got about 5 to 10 minutes to exam in each patient for the rotator cuff muscle. So it's got a lot of long words. Next is the impingement. Impingement is, I think it's like similar to the rotator cuff, but the problem is when you do the repetitive overactivity of the overhead, you do it again. The space on the roof of the supraspinatus and the acromion, they have a loop, and the bursa is like a fluid, okay, allowed there. The fluid got inflammation, we call bursitis or anything. Something over that we got pain on the shoulder also. So that's why we get many problem on the shoulder. The impingement is also got you had a painful arc. Painful arc is like when you do it on the 0 to 60, it's no pain. But when it's 60 to 120 degrees, wow, it's so much pain because they got some impingement. And when it's over the 120, you feel free again. That is the one side of the impingement. Okay. This is only the example. That is the frozen shoulder. Yeah. Some say the adhesive capsulitis because the capsule of the shoulder got inflammation, so we call capsulitis. Okay. We got thickening, we got fibrosis, we got the capsule is shrinking. The loom on the shoulder is smaller because of the capsule is inflamed, is bigger capsule. So that's why the space is smaller. The frozen shoulder, we got 3 states: freezing, frozen, thawing, and I'm not sure of correct pronunciation, like thawing. There we got a stiffness and pain. because it have a small room. That's why when we got a frozen shoulder, you limit all the direction, forward, flexion, abduction, adduction, extension. We got limit all the direction because it's all over of the capsule is in frame. So it's frozen. You cannot move. It's frozen. Okay. This T straight that I've told you, the blue line is the lane of motion. It's the motion of you. First, in the freezing state, your motion is still good, and the pain is not much, and the time by 2 or 3 months, you can see on the lower side, 3 months you got more pain, and your motion will be down because you freeze. Okay. Then you've got frozen state. Frozen is like the motion, the blue line is on the bottom. You cannot move now, but the pain is really high. You cannot move. If you move, you will pain. That's why it's frozen. You've got frozen now. Okay, and then thawing is like a relax of the nature of the disease. You got a more motion and you got the less pain. Usually it subsides in the 9 to 18 months. It's a year, almost 2 years. This is the natural history of the frozen shoulder. It's quite long. Okay. That's why we need some physical therapy. We need some medication. Maybe we can shorten, but normally we got a really long run. It's like a marathon when you got a frozen shoulder, not a short running. Okay. The next is osteoarthritis. Normally, when do the bone and the bone, we got a good cartilage. Okay, the cartilage is good, so we can move freely without pain. But when you come with cartilage is damaged, your cartilage is lost. We got a bone spur or anything, we lost the congruence, the spherical of the bone. That's why we got the pain when you moving. It also happens. Okay, but the osteoarthritis we have many states. I may tell you about it. Like the first one is like a good spherical with not much of the spur. Then the spherical is lost, the spur is too much, and in the last one, the bone is collapsed, the spherical is lost. So that's why we got a many stages. The X-ray will help you to find out when you got. That's why why don't we can come back to the 100%? It maybe have some mind of the osteoarthritis or severe osteoarthritis. Okay. Bicep is very common to find out. Bicep is on the front of your arm. Okay, bicep. And when you repetitive activity again and again or heavy lifting, sometimes you got the bicep tendinitis, the bicep inflammation. And in the baseball player, we like throwing. Okay, you have to look at the labor. What is the labor? Labor is a rebum. When you got a ball and socket, okay, that I mentioned earlier, the ball and socket. The socket, we have like a bone and the cup. The cup around the socket is the tissue called labor. Okay, the bicep tendon, the very big on the front arm, is have the head that contact to the labor. That's why when we got the bicep injury, repetitive over and over, or maybe in the baseball player, we got the shoulder injury also. Okay. Now let's see. This is the table that they correct from the Sweden. What the most popular one is the rotator cuff syndrome. Okay. The second is the impingement, and the third is the frozen shoulder adhesive capsulitis. Okay. But I tell you, this is the consultant, so maybe they just act for. But when we meet the specialist, most of the time they combine. Why? Because when you got the rotator cuff tear and you extend prolong the rotator cuff tear, what happened? You got the pain in the shoulder. You don't want to move it. What happened when you want to move it? You got a freezing state. When you don't move it again, now you got a frozen state. That's why it may be combined. Combine impingement with the frozen, combine rotator cuff with the frozen, and anything can combine. Impingement can combine with the rotator cuff. Okay. So, but what is the real problem? We have to check. Okay. So we have to find out what is the real problem of the shoulder. is the first of the review of the disease that we common know. Anyone want to share more experience or anyone want to share anything?
Hello, doctor.
Yes.
I had an accident about 8 years ago. I fell about 2 meters onto concrete on my shoulder, and I broke up everything. And I put up with the pain for years, sleepless nights, and get paracetamol. And eventually I went for an MRI, and it was pretty bad. So I contacted the orthopedic surgeon, and I had a complete shoulder replacement,
Shoulder replacement. Okay.
titanium cup and organ cup, and now it's complete. It gives me absolutely no problem whatsoever.
Wow, I'm happy to hear that. There will be more about the shoulder replacement in the next few slides also.
So, learn the lesson. You know, pain is nature's way of telling you you're an idiot if you don't go to the hospital. Okay. Does anybody else want to share something? Thank you for sharing that. Somebody over this way, somewhere, going to share something shoulder-wise?
Yes, okay.
3 years ago. Pardon me? Oh, 5 or 6 years. I put up with it. Yeah, when it was about 7 years, I put up with it.
That's okay, it's okay. Just 1 year.
Anybody else want to share one of their shoulder adventures? Stage? Okay.
Okay, I will go next, and if you have the question on the end of the talk, it's okay, feel free to ask, okay? So, what is the risk factor for the problem that I concerned tell you before? The age. Everybody got old. The fact, so we cannot change that. The age is also related. The chronic disease, like diabetes, the cardiovascular, the thyroid disease. So if you have any problem of that, there may be a risk factor for have a shoulder problem because your metabolism is changed. Okay, the lifestyle factor. Okay, somebody got a very sedentary behavior. I don't want to do anything. That's become lazy, and you got a easy for the injury, and you got the easy for the pain of the shoulder. Okay, the obesity, the previous injury or surgery also. But the first and the last one, we cannot change it because it's the past and the fact. So the main we have to control is the chronic disease and the lifestyle. Okay, and I tell you. So that's why we got to the diagnosis. To know what are you going to do with the shoulder pain. Maybe some from history, we can talk it, we can exam, which had take a time, and the investigation, the X-ray and the MRI will also help you to identify what the problem of the shoulder. The role of the physiotherapist to help you in the motion, and the orthopedic will help you to find out what is going to be. Okay. Every patient, I will suggest to use the non-surgical treatment first. Nobody come here like, okay, I will surgery you. No. Okay, we will try with the physical therapy. Okay, we improve your strength and flexibility. What is strength and flexibility? Okay, the fast one, twitching one, like the baseball, like I tell you earlier, that's not a good one. Okay, it's very fast, it's very twitching. That will be cause you some hurt in the future. So you got to be slower and steady. That will be improve your stretching, your strength. Okay. The medication, I'm not type of the medication because if you take too much medication, the other problem will come along. So I will take a less medication as possible. The injection is may help in some case with the steroid when you got some bad inflammation or like or pellet-rich plasma. It's a new one, but it's also got some improvement. Some paper proof that can help in the healing of the some rotator cuff, but also it's just the option. Okay, please. Okay, the HA, hyaluronic acid. It's also here too. The HA is the like a, I'm sorry, but it's also the commercial one. But it's a good for it's like a lubricant for your shoulder. If you got some mild or moderate osteoarthritis, the HA will also help. Okay, I didn't like it, but it's okay. You can use it, and it's good. I have all using. Oh yes, but the knee is very helpful. But the shoulder is yeah, it's less from the paper. But it's okay. You can try because I think there's no wrong. Okay. Also the other injection is also no wrong. Okay. About the surgery, the surgery that we mostly do is the arthroscopic. When you got the tear of your rotator cuff, we just repair it. Okay, we use the arthroscope and we use the suture, anchor and the fiber wire to suture it. Okay, normally the all of the implant in the body, we use the Europe or American standard. So no Chinese. No. Okay. And post-operative protocol, like when you repair it, it doesn't mean that tomorrow you can do it activity like the prop as like a normal when you repair, okay? Because the repair we have a healing time, okay? The healing time, like the rotator cuff, we use about 4 to 6 months. It doesn't mean that you can repair it and you can do it again tomorrow, next week, next month. No, that takes a time. That's why David Seaman got lots of the time when he got the repair his shoulder for about 6 months, I guess. Other other complications like, and when you scope, it not have a only the good side, the bad side also. The bad side is like a arthrofibrosis, a stiffness. After repair the shoulder, you got to physiotherapy for the for the motion. Okay. Okay. But have anyone got a shoulder repair? I think some of you got it. Shoulder repair. Okay, maybe next time. Like to ask, what time do you think you can completely back to the normal after the repair? So I tell you, either 4 to 6 months. So I'm gonna ask other people. Okay, okay.
Yes, I was advised by the surgeon to, did I have a swimming pool at the condo? And I said we did, so he gave me a series of exercises to use in the pool, which I did twice a day, and it took about, as you say, 4 to 6 months to really clear up. No pain anymore.
Thank you. Thank you for sharing. Today is sharing, okay? So maybe I'm not the correct one. Your experience is more important than I'm talking, okay? Okay,ครับ. The other complication like you have to sleep on when you surgery. It got general anesthesia. It got every surgery have a list of infection. 1-2%, not much, but everyone got the list. Okay. So other thing is the shoulder replacement or shoulder arthroplasty. We use it in the osteoarthritis or in the massive irreparable rotator cuff tear. When you cannot repair it anymore, okay, that's the simple. When you cannot repair it, when you cannot do it, we change it. Okay? The complication of your change is because tear progression. Okay, if you have some type of the shoulder replacement, maybe some muscle or ligament may be still tear. Okay, so we have to be careful. The prosthesis can loosening. The prosthesis can be instability at the least. Okay, infection and anything is also the same. But today we got a more of the favor that we have a good outcome for about 90% in the last 10 years. So it's like improvement. Okay, they got a room for the improvement of the shoulder replacement. That's why they are more popular in the shoulder replacement nowadays. It's like a new technology. but not everyone is going to jump to the orthoplasty. Okay, we got to describe, they got to discussion about what the problem. If the problem only the rotator cuff tear, maybe we just repair it first. But if the problem is too much for repair, then we're gonna talk about replacement. Okay. So most of time in this room, you got a good, already have a good shoulder. So I think we've got a prevention not to have a bad one. And what we got to do, the lifestyle change, maintaining a good health, about the weight, about staying active, not too sedentary. But I think most of the time people around here have a good activity. Okay, it's not like a Thai people. The Asian people is sometimes they got a sedentary. Like my mom, maybe he's too lazy to exercise, so I don't like that too. Okay, so I encourage to exercise. Okay, so important the exercise, stretching and strengthening. Don't do it too fast, too rapid. Okay, when you do it, move it too quickly, it causes the injury. Just slowly. Okay, and tip to avoid the injury. First, good exercise, like you. Second, good rest, and third, good food. Okay, three things, simple. This is the graph. The upside is the performance. Okay, you will have a good performance if you have a good exercise and good rest. Okay, when you have enough rest, the time when you go down from the rest, it can also jump to the more high performance. That's why we have need a good rest also. Good exercise and good rest, you have come with a good performance. Okay. But in the opposite side, if you over activity, you do too much exercise but you not have a good rest, especially for the sportman, you will have a down slope of the performance. Okay, the performance will be worsen, because you under the recovery, you not have a good rest. And when you proceed to the line of the prolonged recovery, we got a prolonged symptom. That's why we call the overtraining syndrome. And we come with another injury problem. Okay, your performance is down. When will you know that you got the performance is down? Oh, sorry. When we got the decreased training capacity, your aim, you cannot reach your aiming. Yesterday I can do it, but today I cannot. Tomorrow I cannot like do the same thing, because maybe you got a too high of your target. It is a tailor-made, so I cannot tell you that everyone gonna do the same thing. No, I have to tell you in the one by one. Okay, no, not everyone got the same aiming. Okay, the performance. You feel you trying too easy. If you got this side of the problem of your exercise, I recommend you to step down your exercise program, like a 50% for a week. If it's 50%, you can do it on a week. The next week, you may go up with a 10%, like a 60%. 60% on the week. If it's okay, the next week go up to 70% on the week. That's why your performance will be increased. But if you're gonna do leaching, we call overleaching or overtraining, it will be a performance will be down. So be careful. That's slow and steady. Okay. Okay. I think everyone would like to see a good performance today. Okay. And the good food. There are many recommendations, so I'm not going to about the detail of the food, because today they got many marketing about it. The protein, okay, the calcium, the vitamin D, the water, and the medication if you got a chronic medication. This is the key for the good health. Okay, just take this for. I don't think you have to need to buy a vitamin or any supplement if you already have a good dietary in the normal day. If you have a milk, if you have a protein, if you have an egg, you may not need the supplement. Okay, but if someone thinks you cannot eat too much, you may. Okay, but with vitamin, with marketing, you like it, feel free to use it. Okay, I'm not gonna bias anything. So the conclusion. Early recognition that you got a shoulder problem, seeking the medical help because, like I tell you, some more than 50% has more than 3 months of the problem. Okay, and less good exercise, good rest, and good food will help you achieve this. Okay, thank you. Anyone want to sharing something? Okay.
My question is, because I've had bad knees, and with the shoulder, what sort of result have you had with PRP and cortisone injections? I see are an option.
Okay, it's the option because it's up to the disease you got. I'm not gonna injection steroid to everyone. No, you got to be like a have a very bad of the inflammation locally. The locally injection will help. Okay, the PRP will be help if you get a small tear that no need to surgery. The PRP will help of your lower cuff, small tear. Okay, but
So-
not everyone gonna use the PRP. Not everyone gonna use the
Yeah,
steroid.
I had both on my knees. And PRP, I'm not sure, sort of 50-50 whether it helps or not.
Yeah. The PRP, the benefit is not high, but it's not bad. And I say it's not bad because it's your own blood. In the theory, you got from your own blood, and you got the pellet from your own blood to help it healing. But it's demand of the many factor like your already condition of the knee. If it's too many damage, maybe the pellet PRP will be have a less benefit. Okay, so it's up to the disease condition. And the PRP, the good thing is you can injection many times, not like the steroid. The steroid, if you injection that, you're gonna do it again. I will be considerate about the infection, the more inflammation. Maybe someone got the injection of the steroid and have the progressive tear of the rotator cuff. Okay, so
Yeah,
so I
this
have to-
is very interesting because I want to do PRP again, and I don't want to do steroids because they can damage your bones and things if you have it done too many times.
yeah, it's just a pro and con. So no right, no wrong. Okay.
Well,
Okay,
thank you for coming today. I have two questions. What foods to avoid for inflammation in the joints?
I think you go back, you got to control your general medication. What food to avoid is like if you got the hyperlipidemia, it is up to you. If you got already have the high lipid of your blood, you may have to lower your fat. Okay? If you have a diabetes, you have to lower your sugar. Yeah. So it's up to your medical condition. But if you're healthy and you check up and you know got no any medication, I think the good food is like a healthy one. Is anything you can eat.
Question number two. Every morning I exercise with my son before he goes to school, and we do jumping jacks. Versus, is one better than the other?
The jumping jack, I think you got to do slower. Yeah, because this is too fast.
Too fast.
Yeah, because the sun maybe like really quick.
Yes,
Yeah,
yes,
yeah.
yes.
You maybe have to appreciate him. Wow, you look fast, but I'm just slower.
Yeah,
Okay, thank you.
Too fast.
you tell him he's got to do 3 to
Your
every
wife.
your 1. You know.
Okay, Cap. Any question or any sharing experience?
Any other questions, comments, observations?
Thank you for your presentation. When I was younger, they'd always use like a hot water bottle or something on pain. Is there a general rule when to use hot, when to use cold, like ice pack?
Okay, it's good question. I always recommend in the hot or cold is like your natural feeling. If you feel good, it's good. That's the simple. But when to avoid the hot? The avoid to hot is when you got a real trauma, like you just accident. If you get any accident, I think you should avoid the hot because when you got accident, it will be swelling. It will be have a problem if you got an accident. So if no accident, I think warm or cold, you can do it. And if you like anything, you just use that. The nature, your feeling, nobody lying, okay? Just like your feelings feel. Avoid the accident, okay? About maybe a week, okay, to avoid the heart.
Hello. You obviously specialise in shoulder problems replacement. I'm getting on in time, as everybody knows, without me telling you. But you didn't mention any supplements. I've been taking cod liver oil ever since I was 15, and it seems to have kept my joints pretty loose. But I do exercise and eat good food. But the other thing you didn't mention was chiropractors. Now I see a chiropractor if I go home to England, and he realigns my body, and I always feel better. Pain that I have got in my lower back disappears. I know this is probably a bit out of your area, but it is an important thing if you can get a good chiropractor and having supplements early on in life.
Thank you. It's very interesting, okay? The chiropractic. Like I tell you, if you try it and it feels good, it's okay for me. Okay?
Thank you for the presentation. Am I ready?
Yeah, sir.
And so I have, I get woke up at night sleeping on my side, my shoulder hurts, and then I go over to the other side. And I've used like Bob and Brad on the YouTube, you know, they said put a pillow under my ribs, so I've done that. Certainly need to lose some weight, but do you have anything about just shoulder pain at sleep?
Or when you sleep, maybe you have to check, like sometimes the physical exam, anything about the related stuff. How long do you have the problem with your shoulder? All the time, about a month, 2 months, 3 months, years. Wow. I think maybe the checkup will help you. First, you got a full motion. So I think the frozen shoulder will be at least okay, good. And the second, I mean, you have a pain, you got to check your activity. Do you have any overactivity frequently? Maybe step down. What is that?
Pickleball.
Oh, wow. Wow, maybe you have to slower. Can you cut it to slower? Okay. and the next thing is, if you got a really bad pain, I think the check up like an X-ray to see that there any joint problem, it will be helpful. Yeah.
Yes, massage is readily available in Thailand, of course, and I'm wondering your opinion on people having massage to improve their shoulder.
Okay. The massage, the massage is very unique in the individual people. Okay. Some got a very strong massage. You know, you got somebody use your knee, use your leg, or like they're kicking you. Okay, but like I tell you, it's natural of your feeling. Like I go to the massage and I feel more pain, so I think it's not good for me. But some people go and they feel like after they do it, it's like relax. It's like my wife, they really love massage. They go every week. So that's why your feeling, I think, is the most thing. They can answer you. If you do it and you feel good, okay, I'm not going to frame that. But if you do it and you feel more, it's a time up and time depending too. Like today we do it good, the next week you do maybe bad, the next week will be good. So the massage, I think, is unique in the time, is unique in the people who massage you. So it's like a very wide factor. If you like it, I don't really.
I used to suffer from shoulder pains. I used to suffer from shoulder pains, and I found that I changed my mattress on the bed, and following that, I have no more problem. So whether or not the mattress supports me more than the old mattress did, or whether it's just the type of mattress I've got, which is one of these, what do you call them, latex ones, which seems to help a great deal.
Oh, if you feel good, it's okay. Yeah, there's like a baby oil, a latex on the massage. Yeah, baby oil. I don't know.
All right. I have a quick comment that's relevant to my friend over there, Chris. Is I get a little bit of a soreness in there, sleeping on that shoulder. But what I use is the Yoko Yoko. I put the Yoko Yoko on, goes away. Yoko Yoko Pharmacy, better than hot and cold. It's anti-inflammatory, herbal. Cannot recommend it too highly. And I cannot recommend this talk too highly. I learnt so much about how shoulders work. I can't believe it. Thank you, Doctor.
Thank you. It's my honor to.
We have a small token of our appreciation. Thank you. Breaking new ground with our first ever speaker from Phyathai Sriracha. Thank you so much, Dr. Kanaphat. And who knows, maybe more in the future. Which then brings us to